to the 2026 PTCB practice test. This test will have 90 questions with explained answers that will help you prepare for this test. Be sure to hit that like button by turning it white. Now here is your pharmacy instructor to walk you through the questions.
Question 1. A technician notices that 2 oral liquid medications require shaking, but only one has an auxiliary label. Why is this a safety concern? A. It affects insurance reimbursement. B. It may result in inconsistent dosing. C. It changes the medication's expiration date. D. It violates federal pharmacy law. The correct answer is B. It may result in inconsistent dosing. Oral suspensions must be shaken to ensure uniform drug distribution. Without proper labeling, patients may not shake the medication, leading to under- or overdosing. Clear labeling is essential for safe medication use. Question 2. Under federal law, which controlled substance schedule requires prescriptions to be maintained separately from all other records? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 5. The correct answer is A. Schedule 2. Schedule 2 prescription records must be stored separately, so they are immediately retrievable for DEA inspection. Schedule 3 to 5 prescriptions may be stored with non-controlled prescriptions if they are readily retrievable. This distinction is frequently tested. Question 3. A pharmacy technician notices a prescription written for digoxin 1 mg daily. Why does this raise an immediate medication safety concern? A. Digoxin is no longer commonly prescribed. B. Digoxin is only available in liquid form. C. Digoxin has a narrow therapeutic index. D. Digoxin cannot be taken once daily. The correct answer is C. Digoxin has a narrow therapeutic index. Digoxin has a very narrow therapeutic index, meaning small changes in dose can lead to toxicity. A 1 mg daily dose is significantly higher than typical maintenance dosing and increases the risk of arrhythmias, nausea, and visual disturbances. Orders involving NTI drugs require careful verification. Question 4. A technician notices that a prescription includes unclear tapering instructions, for example, decrease dose gradually. What is the technician's responsibility during order entry? A. Rewrite the taper schedule. B. Enter as written without comment. C. Ask the patient how they plan to taper. D. Ensure the order is flagged for pharmacist clarification. The correct answer is D. Ensure the order is flagged for pharmacist clarification. Vague tapering instructions can result in improper dosing. Technicians must not create or modify taper schedules. The order should be flagged so the pharmacist can clarify precise instructions with the prescriber. Question 5. A prescription is written as take 0.5 mg daily. What is the primary medication safety concern? A. The dose is outside the usual range. B. The prescription is incomplete. C. The decimal point may be misread. D. The drug strength is unavailable. The correct answer is C. The decimal point may be misread. A missing leading zero increases the risk that 0.5 mg will be misread as 5 mg, resulting in a tenfold overdose. Medication safety standards require using a leading zero, 0.5 mg, to prevent dangerous dosing errors. Question 6. A child weighs 33 pounds. What is the child's weight in kilograms? Round to the nearest tenth. A. 13.5 kilograms. B. 14.0 kilograms. C. 15.0 kilograms. D. 16.5 kilograms. The correct answer is C. 15.0 kilograms. To convert pounds to kilograms, divide by 2.2. 33 divided by 2.2 equals 15.0 kilograms. Question 7. A technician notices a prescription is written for a medication the patient is already taking at a different dose. What is the technician's responsibility during order entry? A. Discontinue the old medication. B. Change the dose to match the profile. C. Enter the prescription accurately to allow DUR review. D. Ignore the duplicate. The correct answer is C. Enter the prescription accurately to allow DUR review. Technicians do not make therapy decisions. Accurate entry ensures the DUR system and pharmacist can identify duplicate therapy or dose changes. This supports safe verification downstream. Question 8. Which task is a pharmacy technician permitted to perform as part of routine pharmacy workflow? A. Final prescription verification. B. Patient counseling on side effects. C. Receiving and stocking medication inventory. D. Interpreting clinical drug interactions. The correct answer is C. Receiving and stocking medication inventory. Pharmacy technicians are permitted to receive, stock, and manage inventory as part of daily operations. Final verification, counseling, and clinical judgment are pharmacist-only responsibilities under federal standards. Question 9. A child weighs 18 kilograms. The prescription is 7.5 milligrams per kilogram per day, divided every 8 hours. The suspension is 125 milligrams per 5 milliliters. How many milliliters per dose should be given? A. 1.8 milliliters. B. 3.6 milliliters. C. 5.4 milliliters. D. 7.2 milliliters. The correct answer is A. 1.8 milliliters. Daily dose equals 7.5 milligrams per kilogram per day, times 18 kilograms equals 135 milligrams per day. Q 8 hours equals 3 doses per day implies 135 divided by 3 equals 45 milligrams per dose. 125 milligrams per 5 milliliters equals 25 milligrams per milliliter. Milliliters per dose equals 45 divided by 25 equals 1.8 milliliters. Question 10. Which situation meets the federal definition of an emergency Schedule II prescription? A. The patient ran out of medication early. B. No alternative medication is available and immediate treatment is necessary. C. The prescriber's office is closed. D. The patient is traveling. The correct answer is B. No alternative medication is available and immediate treatment is necessary. A federally defined emergency exists only when immediate administration is necessary, no alternative treatment is available, and delaying therapy would harm the patient. Convenience, travel, or office closure do not meet the legal definition of an emergency. Question 11. Under federal law, which of the following elements of a Schedule II, C2, prescription is a pharmacist strictly prohibited from changing or adding, even after contacting the prescriber? A. The drug's dosage form. B. The drug's quantity. C. The patient's name. D. The directions for use. The correct answer is C. The patient's name. According to strict federal guidelines, there are 3 components of a C2 prescription that can never be changed. 1. The patient's name. 2. The drug name, unless for generic substitution. 3. The prescriber's signature. While a pharmacist may change or add the dosage form, drug strength, drug quantity, and directions after a direct consultation and agreement with the prescriber, noting the change on the hard copy. The identity of the prescription, who it's for, what it is, and who signed it, must remain exactly as written. Question 12. Why is using the abbreviation U for insulin considered unsafe? A. It violates federal pharmacy law. B. It may be mistaken for 0 or 4. C. It changes the medication's potency. D. It invalidates the prescription. The correct answer is B. It may be mistaken for 0 or 4. The abbreviation U can be misread as the number 0 or 4, leading to significant dosing errors. Medication safety standards require writing out units in full to reduce the risk of potentially fatal insulin overdoses. Question 13. A pharmacy technician notices that hydralazine and hydroxyzine are stored next to each other on the shelf. Why does this present a medication safety risk? A. They require different storage temperatures. B. They treat similar conditions. C. Their names are look-alike/sound alike. D. They have similar dosing schedules. The correct answer is C. Their names are look-alike/sound alike. Hydralazine and hydroxyzine have similar spelling and pronunciation, which increases the risk of selecting the wrong medication. Look-alike/sound alike errors are a major cause of dispensing mistakes. Separating and visually differentiating these drugs reduces error risk. Question 14. During order entry, a technician notices the prescriber wrote metoprolol 100 milligrams BID, but the patient profile shows the patient has only ever taken metoprolol ER. What is the most appropriate action? A. Change the order to extended release to match history. B. Enter the prescription as written and flag for verification. C. Ask the patient which version they prefer. D. Split the dose to avoid side effects. The correct answer is B. Enter the prescription as written and flag for verification. Technicians must enter prescriptions exactly as written and cannot make clinical assumptions or formulation changes. The discrepancy should be flagged so the pharmacist can determine whether the prescriber intended immediate release or extended release. Order entry accuracy is critical to downstream safety checks. Question 15. A technician accidentally begins entering a prescription under the wrong prescriber profile, but catches the mistake before saving. What should the technician do? A. Save the entry and correct it later. B. Leave a note for the pharmacist. C. Cancel the entry and restart correctly. D. Continue if the medication is correct. The correct answer is C. Cancel the entry and restart correctly. Prescriber errors can affect legality, billing, and verification. The entry should be stopped immediately and restarted under the correct prescriber profile to prevent downstream errors. Question 16. A pharmacy technician notices repeated dispensing errors occurring at the same step of the workflow. What is the most appropriate safety response? A. Counsel patients more thoroughly. B. Replace staff involved. C. Ignore errors if no harm occurred. D. Analyze and redesign the workflow process. The correct answer is D. Analyze and redesign the workflow process. Repeated errors at the same workflow step indicate a system flaw rather than individual failure. Analyzing and redesigning the process addresses the root cause and is the most effective long-term medication safety strategy. Question 17. Which workflow practice most reduces the risk of dispensing the wrong prescription to a patient? A. Alphabetizing prescriptions by drug name. B. Using prescription numbers only. C. Organizing will-call bins by pickup time. D. Verifying two patient identifiers at pickup. The correct answer is D. Verifying two patient identifiers at pickup. Using two patient identifiers, typically name and date of birth, is the most effective way to prevent wrong patient errors. This step is a core patient safety requirement at pickup. Question 18. Which medication safety risk is most associated with extended release ER products? A. Reduced absorption. B. Faster onset of action. C. Dose dumping if crushed or split. D. Increased allergic reactions. The correct answer is C. Dose dumping if crushed or split. Extended release products are designed to release medications slowly over time. Crushing or splitting them can cause dose dumping, leading to dangerously high drug levels at once. This is a common safety concept tested with opioids and cardiac medications. Question 19. A pharmacy technician notices that a medication requiring oral administration has packaging similar to an injectable medication. What is the primary concern? A. Incorrect billing. B. Wrong route administration. C. Reduced absorption. D. Shortened shelf life. The correct answer is B. Wrong route administration. Similar packaging between oral and injectable medications increases the risk of wrong route administration. Route errors can result in severe injury or death and are a major focus of medication safety principles. Question 20. During a busy shift, Prescriptions are backing up at verification. What is the most appropriate workflow adjustment? A. Skip barcode scanning to save time. B. Allow technicians to verify low-risk prescriptions. C. Increase speed by bypassing double checks. D. Reassign staff to support verification and data entry. The correct answer is D. Reassign staff to support verification and data entry. Workflow efficiency should be improved by reallocating staff, not removing safety checks. Supporting verification through better task distribution maintains patient safety while improving throughput. Question 21. A medication is supplied as 250 milligram tablets. The prescribed dose is 0.75 grams. How many tablets are needed per dose? A. 2 tablets. B. 2.5 tablets. C. 3 tablets. D. 4 tablets. The correct answer is C. 3 tablets. 0.75 grams equals 750 milligrams. 750 milligrams divided by 250 milligrams per tablet equals 3 tablets. Question 22. A prescription is written for take 1/2 tablet daily, but the tablet is not scored. What should the technician do during order entry? A. Enter the prescription as written. B. Change the dose to the nearest whole tablet. C. Ask the patient if they can split tablets. D. Flag the prescription for pharmacist review. The correct answer is D. Flag the prescription for pharmacist review. Non-scored tablets may not be safe or accurate to split. Technicians must not assume tablet splitting is appropriate. The pharmacist must determine whether the order should be changed or clarified with the prescriber. Question 23. Which medication safety practice is most effective in preventing wrong strength selection errors? A. Faster data entry. B. Relying on memory. C. Counseling every patient longer. D. Barcode verification. The correct answer is D. Barcode verification. Barcode verification confirms the correct drug and strength against the prescription and serves as a final safety checkpoint. It is one of the most effective tools for preventing wrong strength errors. Question 24. Which DEA form is required when a pharmacy reports the theft or significant loss of controlled substances? A. DEA Form 222. B. DEA Form 41C. DEA Form 106. D. DEA Form 224. The correct answer is C. DEA Form 106. DEA Form 106 is used specifically to report theft or significant loss of controlled substances. This allows the DEA to investigate potential diversion. Other DEA forms are used for ordering 222, destruction 41, or registration 224, making them incorrect for this scenario. Question 25. An order is written for 1,000 milliliters of IV fluid over 8 hours. What is the infusion rate in milliliters per hour? A. 100 milliliters per hour. B. 120 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. The correct answer is C. 125 milliliters per hour. Rate equals total volume divided by time. 1,000 milliliters divided by 8 hours equals 125 milliliters per hour. Question 26. A prescription is written for amoxicillin, 400 milligrams per 5 milliliters. The prescriber orders 600 milligrams per dose. How many milliliters should be administered per dose? A. 5 milliliters. B. 6.25 milliliters. C. 7.5 milliliters. D. 10 milliliters. The correct answer is C. 7.5 milliliters, 400 milligrams per 5 milliliters, equals 80 milligrams per 1 milliliter. 600 milligrams divided by 80 milligrams per milliliter equals 7.5 milliliters. Question 27. A pharmacy technician notices that potassium chloride oral liquid is stored next to sodium chloride oral solution. Why is this a serious medication safety concern? A. Confusing the products could cause fatal electrolyte disturbances. B. Potassium chloride expires faster. C. Both solutions look cloudy when shaken. D. Sodium chloride requires refrigeration. The correct answer is A. Confusing the products could cause fatal electrolyte disturbances. Potassium chloride dosing errors can lead to severe hyperkalemia, causing fatal cardiac arrhythmias. Confusing it with sodium chloride, which is far less dangerous, has resulted in serious patient harm. Electrolytes like potassium are classified as high-alert medications for this reason. Question 28. A technician identifies that multiple high-alert medications are being stored alphabetically without additional safeguards. Which improvement would most effectively reduce error risk? A. Increasing technician experience requirements. B. Storing all medications alphabetically. C. Removing high-alert labels. D. Adding visual alerts and separating high-alert drugs. The correct answer is D. Adding visual alerts and separating high-alert drugs. High-alert medications require additional system safeguards beyond alphabetical storage. Visual alerts and physical separation reduce selection errors and are recommended safety strategies for medications with high harm potential. Question 29. A technician accidentally selects the wrong patient profile during order entry, but realizes the error before saving. What is the most appropriate action? A. Save and correct later. B. Continue entry if demographics are similar. C. Cancel the entry and restart under the correct profile. D. Leave a note for the pharmacist. The correct answer is C. Cancel the entry and restart under the correct profile. Wrong patient errors are high risk. The entry should be stopped immediately and restarted under the correct profile to prevent downstream dispensing errors. Notes do not adequately protect against patient harm. Question 30. Why are tall man letters used in pharmacy workflow systems? A. To speed up order entry. B. To meet insurance requirements. C. To reduce look-alike/sound-alike medication errors. D. To standardize drug pricing. The correct answer is C. To reduce look-alike/sound-alike medication errors. Tall man lettering highlights differences in similar drug names to reduce visual confusion. This system-based safeguard is widely used to prevent look-alike/sound-alike medication errors. Question 31. A technician is entering a prescription that includes conflicting directions in two different fields, for example, take once daily in the SIG and BID in notes. What is the most appropriate action? A. Enter the SIG exactly as written and flag the discrepancy. B. Choose the more common dosing. C. Delete the conflicting information. D. Ask the patient which instruction to follow. The correct answer is A. Enter the SIG exactly as written and flag the discrepancy. Technicians must not interpret or resolve conflicting directions. The prescription should be entered exactly as written so the pharmacist can identify and clarify the inconsistency. Accurate entry ensures discrepancies are caught during verification. Question 32. A technician receives a prescription with directions that read, "Use as directed." Why is this problematic during order entry? A. It slows data entry. B. It increases refill frequency. C. It creates ambiguity that may lead to misuse. D. It violates federal law. The correct answer is C. It creates ambiguity that may lead to misuse. Use as directed, lacks specific dosing instructions, and can result in improper medication use. Clear directions are required for safe dispensing and patient understanding. Ambiguous SIGs should be clarified before processing. Question 33. A pharmacy technician notices two different routes of administration for medications with similar names stored together. What is the primary risk? A. Insurance billing errors. B. Wrong route administration. C. Reduced medication efficacy. D. Delayed pickup times. The correct answer is B. Wrong route administration. Storing medications with similar names but different routes together increases the risk of administering a drug by the wrong route. Route errors can cause severe injury or death and are a major medication safety concern. Question 34. Which situation represents a near-miss medication error? A. A patient experiences hypoglycemia after insulin use. B. The wrong medication is dispensed and taken. C. A technician selects the wrong drug but catches it before dispensing. D. A patient refuses counseling. The correct answer is C. A technician selects the wrong drug but catches it before dispensing. A near miss occurs when an error is identified and corrected before the medication reaches the patient. Near miss reporting is critical because it reveals system weaknesses without patient harm and helps prevent future errors. Question 35. Convert 104 degrees Fahrenheit to degrees Celsius. Round to the nearest whole number. Formula: degrees Celsius equals degrees Fahrenheit minus 32 times 5/9. A. 36 degrees Celsius. B. 38 degrees Celsius. C. 40 degrees Celsius. D. 42 degrees Celsius. The correct answer is C. 40 degrees Celsius, 104 minus 32, equals 72. 72 times 5/9 equals 72 times 0.555, equals 40 degrees Celsius. Question 36. A pharmacy technician notices repeated interruptions during prescription filling. What workflow change? Best improve safety. A. Increasing technician speed. B. Establishing a no interruption zone. C. Reducing patient counseling. D. Allowing multitasking during filling. The correct answer is B. Establishing a no interruption zone. Interruptions increase cognitive load and error rates. No interruption zones protect high-risk tasks like filling and labeling, making them a proven safety improvement in pharmacy workflow. Question 37. A pharmacy technician notices that 2 concentrations of epinephrine injection are stored together in similar packaging. What is the most significant safety risk? A. Accidental administration of the wrong concentration. B. Reduced medication stability. C. Delayed onset of action. D. Increased allergic reactions. The correct answer is A. Accidental administration of the wrong concentration. Epinephrine dosing is concentration dependent, and selecting the wrong concentration can cause severe cardiovascular effects or death. Similar packaging increases the risk of selecting the wrong strength, making physical separation and clear labeling critical safety measures. Question 38. While entering a prescription, a technician notices the quantity written does not match the directions. For example, 30 tablets for BID dosing over 30 days. What should the technician do? A. Adjust the quantity to match directions. B. Enter as written and let the pharmacist address it. C. Ask the patient which is correct. D. Change the day's supply. The correct answer is B. Enter as written and let the pharmacist address it. Technicians must not change prescription details. The order should be entered as written, so the pharmacist can identify and resolve the discrepancy. Accurate entry allows verification systems to catch inconsistencies. Question 39. A pharmacy technician prints a label for the wrong patient but identifies the error before it is applied. How is this event classified? A. Sentinel event. B. Adverse drug event. C. Medication discrepancy. D. Near miss. The correct answer is D. Near miss. A near miss is an error that is discovered and corrected before reaching the patient. Reporting near misses is important because it helps identify system weaknesses without patient harm. Question 40. Which document is most important for maintaining accurate inventory control in a pharmacy? A. Prescription hard copies. B. Daily will call log. C. Purchase invoices and receiving records. D. Patient medication profiles. The correct answer is C. Purchase invoices and receiving records. Purchase invoices and receiving records document what medications were ordered and received. They are essential for inventory reconciliation, detecting shortages, and preventing diversion. Prescription and patient records do not track stock movement. Question 41. Under the Federal Controlled Substances Act, which controlled substance schedule cannot be refilled? A. Schedule 2. B. Schedule 3. C. Schedule 4. D. Schedule 5. The correct answer is A. Schedule 2. Schedule 2 medications are not refillable under federal law because of their high abuse potential. Each dispensing requires a new prescription issued by the prescriber. Schedules 3 to 5 may be refilled within specific federal limits, making Schedule 2 the only correct choice. Question 42. Which medication safety risk is most associated with opioid medications? A. Severe hypoglycemia. B. Respiratory depression. C. Acute kidney failure. D. Loss of therapeutic effect. The correct answer is B. Respiratory depression. Opioids depress the central nervous system and can suppress respiratory drive. Dosing errors can quickly lead to fatal respiratory depression, which is why opioids are considered high-alert medications requiring additional safeguards. Question 43. A pharmacy technician notices that heparin vials of different concentrations have nearly identical packaging. What is the best immediate safety action? A. Add auxiliary labels. B. Counsel patients more thoroughly. C. Store the vials alphabetically. D. Physically separate the concentrations. The correct answer is D. Physically separate the concentrations. Heparin is a high-alert medication, and concentration errors can be fatal. Physically separating different strengths is a system-based safety strategy that prevents selection errors before they occur. This is more effective than relying on labels or counseling alone. Question 44. A pharmacy technician selects the correct medication but the wrong strength during filling. Which safety system is most likely to detect this error before the medication reaches the patient? A. Inventory reconciliation. B. Barcode scanning. C. Shelf labeling. D. Insurance claim review. The correct answer is B. Barcode scanning. Barcode scanning verifies the drug, strength, and formulation against the prescription. It serves as a critical final safety checkpoint and is specifically designed to catch wrong drug and wrong strength errors. Question 45. A pharmacy technician receives a prescription for methotrexate written as take 10 milligrams daily. Why is this order a serious medication safety concern? A. Methotrexate should only be used short-term. B. Daily dosing greatly increases toxicity risk. C. The dose is too low to be effective. D. Methotrexate must be taken with food. The correct answer is B. Daily dosing greatly increases toxicity risk. Methotrexate is typically dosed once weekly, not daily, for most non-oncology indications. Daily dosing dramatically increases the risk of bone marrow suppression, liver toxicity, and death. The PTCE frequently tests methotrexate as a high-risk medication due to dosing frequency errors. Question 46. During order entry, a technician notices the prescription directions conflict with the route listed. For example, apply by mouth. What is the most appropriate action? A. Correct the route to match the drug form. B. Enter only the directions. C. Ignore the route field. D. Refer the prescription for clarification. The correct answer is D. Refer the prescription for clarification. Conflicting directions and routes create a high risk of misuse. Technicians cannot assume intent or correct clinical details. The discrepancy must be clarified by the pharmacist before the order proceeds. Question 47. While entering a prescription, a technician selects the correct drug but the wrong route of administration. Which downstream system is most likely to catch this error? A. Drug Utilization Review, DUR. B. Inventory reconciliation. C. Insurance adjudication. D. Will Call Bin Organization? The correct answer is A. Drug Utilization Review, DUR. DUR systems evaluate clinical appropriateness, including dose, route, and therapy conflicts. A route mismatch often triggers alerts because dosing and indications differ by route. This is why accurate entry is essential for effective safety checks. Question 48. A pharmacy technician discovers repeated near misses involving the same medication name. What is the most appropriate action? A. Reprimand staff involved. B. Increase technician workload awareness. C. Document only if harm occurs. D. Report the trend for system-level changes. The correct answer is D. Report the trend for system-level changes. Near-miss trends reveal vulnerabilities in the medication use process. Reporting allows implementation of safeguards like tall man lettering or workflow redesign. Preventing harm is the goal, even when no injury has occurred. Question 49. Which medication safety practice most effectively reduces wrong patient errors at pickup? A. Alphabetizing prescriptions by last name. B. Using prescription numbers only. C. Verifying two patient identifiers. D. Increasing technician speed. The correct answer is C. Verifying two patient identifiers. Using at least two patient identifiers, commonly name and date of birth, is a core medication safety practice. This verification step significantly reduces the risk of dispensing medications to the wrong patient. Question 50. A prescription includes multiple SIG components, but the frequency is missing. Why must this be addressed before processing continues? A. It will cause insurance rejection. B. It prevents accurate labeling and safe use. C. It affects inventory counts. D. It delays patient pickup. The correct answer is B. It prevents accurate labeling and safe use. Frequency is essential for safe medication use and accurate labeling. Without it, the patient may misuse the medication. Incomplete SIGs must be clarified to prevent dosing errors. Question 51. An IV order is 500 milliliters over 4 hours using tubing with a drop factor of 15 drops per milliliter. What is the flow rate in drops per minute? Round to the nearest whole number. A. 25 drops per minute. B. 28 drops per minute. C. 30 drops per minute. D. 31 drops per minute. The correct answer is D. 31 drops per minute. 500 milliliters divided by 4 hours equals 125 milliliters per hour. 125 milliliters per hour divided by 60 equals 2.083 milliliters per minute. 2.083 times 15 equals 31.25 grams per minute implies 31 grams per minute. Question 52. A technician notices that two medications with similar names appear next to each other in the order entry drop-down list. What is the greatest risk at this stage? A. Inventory shortages. B. Wrong drug selection. C. Incorrect pricing. D. Delayed pickup. The correct answer is B. Wrong drug selection. Drop-down lists increase the risk of selecting the wrong medication when names look or sound alike. This is one of the most common sources of order entry errors and a major focus of PTCE medication use safety. Question 53. During order entry, a technician notices that the prescriber used non-metric units, for example teaspoons, in the directions. What is the primary concern? A. Insurance billing issues. B. Increased risk of dosing errors. C. Slower data entry. D. Inventory inaccuracies. The correct answer is B. Increased risk of dosing errors. Non-metric units increase the risk of patient dosing errors. Medication safety standards recommend metric-only instructions to reduce confusion and improve accuracy. This is a common PTCE safety concept. Question 54. A pharmacy technician receives a written prescription for a Schedule II medication that is missing the prescriber's DEA number. What is the correct action under federal law? A. Process the prescription if the DEA number is on file. B. Dispense a partial supply until corrected. C. Return the prescription to the patient unfilled. D. Refer the prescription to the pharmacist for prescriber contact. The correct answer is D. Refer the prescription to the pharmacist for prescriber contact. Federal law requires Schedule II prescriptions to be complete before dispensing, including the prescriber's DEA number. A technician cannot add, assume, or retrieve missing legal information independently. The pharmacist must contact the prescriber to legally correct the prescription. Dispensing any amount before correction is prohibited. Question 55. Which medication is classified as high alert because dosing errors can rapidly cause severe or fatal harm? A. Metformin. B. Insulin. C. Amoxicillin. D. Loratadine. The correct answer is B. Insulin. Insulin is considered high alert because even small dosing errors can cause severe hypoglycemia, seizures, coma, or death. High alert medications require extra safeguards during storage, preparation, and dispensing. Question 56. A pharmacy technician notices a medication label printed with the wrong directions, but the correct drug and patient. What is the most appropriate action? A. Correct the directions and dispense. B. Discard the label and print a corrected one. C. Ask the patient how they usually take it. D. Leave the directions unchanged. The correct answer is B. Discard the label and print a corrected one. Incorrect directions can cause serious harm even if the drug and patient are correct. The label must be reprinted with accurate instructions before dispensing. Technicians must not assume or modify directions without proper correction. Question 57. During order entry, a technician notices the prescriber used both metric and household units in the same SIG. For example, 5 milliliters, 1 teaspoon. Why is this discouraged? A. It increases the risk of dosing confusion. B. It violates federal law. C. It delays verification. D. It affects insurance billing. The correct answer is A. It increases the risk of dosing confusion. Using multiple measurement systems can confuse patients and lead to incorrect dosing. Medication safety standards recommend using metric units only to reduce errors. Question 58. A solution labeled 1 to 2,500 contains how many milligrams per milliliter? A. 4 milligrams per milliliter. B. 2.5 milligrams per milliliter. C. 1 milligram per milliliter. D. 0.4 milligrams per milliliter. The correct answer is D. 0.4 milligrams per milliliter. 1 to 2,500 means 1 gram in 2,500 milliliters. 1 gram equals 1,000 milligrams implies 1,000 milligrams divided by 2,500 milliliters equals 0.4 milligrams per milliliter. Ratio strength questions test unit conversion plus division accuracy. Question 59. How many milliliters of 70% alcohol are needed to make 1,000 milliliters of 35% alcohol? Assume dilution with water. A. 250 milliliters. B. 500 milliliters. C. 700 milliliters. D. 850 milliliters. The correct answer is B. 500 milliliters. Use C1V1 equals C2V2. V1 equals 35% times 1,000 milliliters divided by 70% equals 35,000 divided by 70 equals 500 milliliters of 70%. Then add water to 1,000 milliliters. Question 60. A pharmacy technician notices a prescription written for levothyroxine 0.25 milligrams instead of 25 micrograms. Why is this a serious medication safety concern? A. Levothyroxine should never be written in milligrams. B. The dose is lower than therapeutic range. C. A unit conversion error could cause a tenfold overdose. D. Levothyroxine is only available in micrograms. The correct answer is C. A unit conversion error could cause a tenfold overdose. Confusing milligrams and micrograms can result in a tenfold dosing error. Levothyroxine is typically dosed in micrograms, and decimal or unit errors can lead to significant cardiac and metabolic complications. Unit conversion errors are a high-yield PTCE safety topic. Question 61. A technician is entering a prescription for a medication that requires titration, but the titration schedule is missing. What is the primary concern? A. Insurance rejection. B. Incomplete directions that may lead to misuse. C. Incorrect days supply. D. Inventory shortages. The correct answer is B. Incomplete directions that may lead to misuse. Titration medications require clear step-by-step dosing instructions. Missing schedules can cause under- or overdosing. Incomplete SIGs must be clarified to ensure safe patient use. Question 62. How long must a pharmacy retain controlled substance prescription records under federal law? A. 1 year. B. 2 years. C. 5 years. D. Permanently. The correct answer is B. 2 years. Federal law requires controlled substance records to be retained for a minimum of 2 years for DEA inspection. While some states require longer retention, the PTCE tests the federal standard unless otherwise specified. Choosing 2 years reflects the baseline federal requirement. Question 63. A prescription is written for lisinopril 10 milligrams. Take 1 tablet daily, number 90. But the prescriber signed it without a date. What should happen during order entry? A. Enter the prescription and flag it for pharmacist review. B. Add today's date to complete the order. C. Ask the patient when it was written. D. Cancel the prescription. The correct answer is A. Enter the prescription and flag it for pharmacist review. Technicians must not add missing prescriber information. The prescription should be entered exactly as written and flagged, so the pharmacist can determine whether clarification or correction is required before dispensing. Question 64. A pharmacy technician notices that vincristine is stored in the same area as IV fluids. Why is this a critical medication safety issue? A. Vincristine has caused fatal route of administration errors. B. Vincristine requires refrigeration. C. Vincristine expires rapidly once opened. D. Vincristine interacts with IV electrolytes. The correct answer is A. Vincristine has caused fatal route of administration errors. Vincristine must never be administered intrathecally. Storing it near IV fluids has led to fatal wrong route errors. This medication is specifically highlighted in national safety alerts and is a high-yield PTCE topic. Question 65. A prescription includes directions in Latin abbreviations that the patient may not understand. Why must this be addressed during order entry? A. Insurance claims will reject. B. Latin is no longer legal. C. It slows down verification. D. Directions must be converted to clear patient-friendly language. The correct answer is D. Directions must be converted to clear patient-friendly language. Prescription directions must be clear and understandable to the patient. Latin abbreviations should be translated into plain language during processing to ensure safe and effective use. This is a key PTCE order entry responsibility. Question 66. Under federal law, which DEA form is required for a pharmacy to order Schedule II controlled substances from a wholesaler? A. DEA Form 41. B. DEA Form 106. C. DEA Form 224. D. DEA Form 222. The correct answer is D. DEA Form 222. DEA Form 222 is required to order or transfer Schedule II controlled substances. It establishes a closed system of distribution and allows the DEA to track Schedule II medications from manufacture to dispensing. Form 41 is for destruction, Form 106 for theft or loss, and Form 224 for registration. Question 67. A pharmacy technician notices repeated near-miss errors involving the same medication name. What is the most effective long-term medication safety response? A. Reprimand the staff involved. B. Increase technician speed awareness. C. Ignore the issue since no harm occurred. D. Implement system-level safeguards. The correct answer is D. Implement system-level safeguards. Repeated near misses indicate a system failure, not individual negligence. Implementing system-level changes, such as tall man lettering, shelf separation, or workflow redesign, is the most effective way to prevent future errors. Question 68. Why is barcode scanning considered a critical step in pharmacy workflow? A. It speeds up insurance billing. B. It replaces pharmacist verification. C. It tracks technician productivity. D. It helps prevent wrong drug and wrong strength errors. The correct answer is D. It helps prevent wrong drug and wrong strength errors. Barcode scanning verifies the correct drug, strength, and dosage form against the prescription. It is a system-based safety check designed to catch errors before dispensing. Question 69. Which action is permitted under federal law for a Schedule III controlled substance? A. Unlimited refills within 1 year. B. Transfer between pharmacies one time. C. Partial filling without documentation. D. Refilling beyond 6 months. The correct answer is B. Transfer between pharmacies one time. Schedule 3 to 5 prescriptions may be transferred one time between pharmacies under federal law. They are limited to 5 refills within 6 months and require proper documentation. Unlimited refills or refills beyond 6 months are not permitted. Question 70. Which medication safety issue is most likely when similar packaging is used for different drugs? A. Wrong dose errors. B. Wrong patient errors. C. Wrong drug selection. D. Improper storage. The correct answer is C. Wrong drug selection. Similar packaging increases the risk of selecting the wrong medication during filling. Packaging-related errors are a common cause of dispensing mistakes and are best prevented through physical separation and visual alerts. Question 71. During order entry, a technician sees that a prescription is written for a medication the pharmacy does not stock. What is the most appropriate action? A. Substitute a therapeutically equivalent medication. B. Cancel the prescription. C. Enter the prescription and notify the pharmacist. D. Tell the patient to go to another pharmacy. The correct answer is C. Enter the prescription and notify the pharmacist. Technicians cannot make substitutions or cancel prescriptions. The order should be entered accurately and the pharmacist notified so they can determine whether to order the medication, substitute with prescriber approval, or transfer the prescription. Question 72. A pharmacy technician sees that look-alike packaging has contributed to repeated near misses. Which safety strategy is most effective at preventing future errors? A. Physical separation of similar products. B. Increasing technician speed. C. Relying on counseling alone. D. Reducing inventory. The correct answer is A. Physical separation of similar products. Physical separation is a system-level control that prevents selection errors before they occur. It is more effective than relying on human vigilance and is strongly emphasized in medication safety standards. Question 73. A patient is prescribed metformin 500 milligrams BID for 30 days. How many tablets should be dispensed? A. 30 tablets. B. 60 tablets. C. 90 tablets. D. 120 tablets. The correct answer is B. 60 tablets. BID means 2 tablets per day. 2 times 30 days equals 60 tablets. Question 74. While entering a prescription, a technician notices the prescriber wrote, "Dispense as written, DAW." What is the technician's role? A. Substitute generic if cheaper. B. Ask the patient for preference. C. Enter the prescription exactly as written. D. Remove the DAW instruction. The correct answer is C. Enter the prescription exactly as written. DAW indicates the prescriber intends for the brand name product to be dispensed. Technicians must enter the order exactly as written, so billing and dispensing occur correctly. Question 75. Which situation best demonstrates a system-based medication safety failure? A. A technician misreads a prescription once. B. A pharmacist makes a single calculation error. C. A patient misunderstands instructions. D. Repeated near misses involving the same drug name. The correct answer is D. Repeated near misses involving the same drug name. Repeated near misses involving the same medication indicate a flawed system, not individual mistakes. System-based failures require redesign, such as labeling changes or workflow adjustments, to prevent harm. Question 76. Which medication safety issue is most likely to occur during the prescription data entry phase? A. Wrong patient counseling. B. Wrong drug selection. C. Administration by the wrong route. D. Inaccurate expiration dating. The correct answer is B. Wrong drug selection. During data entry, technicians commonly select medications from drop-down lists. Look-alike/sound-alike drug names increase the risk of choosing the wrong drug at this stage. Later safety checks are designed to catch these early errors. Question 77. During order entry, a technician notices the patient's date of birth does not match the profile selected. What is the most appropriate immediate action? A. Continue entry if the name matches. B. Create a new profile. C. Verify patient identity before proceeding. D. Ask the patient to correct it at pickup. The correct answer is C. Verify patient identity before proceeding. Patient misidentification is a high-risk error point in order entry. Verification must occur before processing continues to prevent wrong patient dispensing. Identity checks are a core safety step at entry. Question 78. A pharmacy technician is entering a prescription that includes both a strength and a total daily dose, but the two do not mathematically match. What is the most appropriate action? A. Correct the daily dose to match the strength. B. Enter the prescription exactly as written and flag it. C. Ask the patient which dose they usually take. D. Adjust the quantity to compensate. The correct answer is B. Enter the prescription exactly as written and flag it. Technicians must not resolve dosing inconsistencies. The prescription should be entered exactly as written so the pharmacist can identify and clarify the discrepancy. Accurate entry is critical for safe verification. Question 79. A technician is entering a prescription and notices the prescriber wrote QOD in the directions. Why is this problematic during order entry? A. It violates insurance billing rules. B. It may be misinterpreted, leading to dosing errors. C. It increases refill frequency. D. It is not allowed for controlled substances. The correct answer is B. It may be misinterpreted, leading to dosing errors. QOD, every other day, can easily be misread as QD, daily, resulting in incorrect dosing. Medication safety standards discourage unsafe abbreviations. Ambiguous SIGs should be clarified before processing. Question 80. Using alligation, how many milliliters of 10% solution are needed to prepare 120 milliliters of 25% solution using 10% and 40%? A. 60 milliliters. B. 40 milliliters. C. 80 milliliters. D. 90 milliliters. The correct answer is A. 60 milliliters. Alligation parts. 40 minus 25 equals 15 parts of 10%. 25 minus 10 equals 15 parts of 40%. So it's a 1-to-1 mix. Half of 120 milliliters equals 60 milliliters of 10%, and 60 milliliters of 40%. Question 81. During order entry, a technician notices that a medication is written for a non-standard dose that does not match available strengths. What should the technician do? A. Adjust the dose to the closest strength. B. Enter the prescription and alert the pharmacist. C. Change the quantity dispensed. D. Reject the prescription. The correct answer is B. Enter the prescription and alert the pharmacist. Technicians cannot adjust doses or make clinical decisions. The order should be entered accurately and brought to the pharmacist's attention so appropriate clarification or prescriber contact can occur. Question 82. A prescription reads, "Take 1.5 tablets PTCB. The pharmacy dispenses 135 tablets. What is the day's supply? A. 20 days, B. 25 days, C. 30 days, D. 40 days. The correct answer is C. 30 days. TID equals 3 times per day. Daily use equals 1.5 times 3 equals 4.5 tablets per day. Days supply equals 135 divided by 4.5 equals 30 days. Question 83. Which individual may legally prepare a controlled substance prescription but may not sign it under federal law? A. Pharmacist. B. Authorized agent of the prescriber. C. Pharmacy technician. D. Nurse. The correct answer is B. Authorized agent of the prescriber. An authorized agent may prepare a controlled substance prescription, but only the prescriber may sign it. The prescriber's signature cannot be delegated. This rule applies to all controlled substance schedules. Question 84. Which individual is legally responsible for ensuring compliance with federal controlled substance regulations in a pharmacy? A. Pharmacy technician. B. Store manager. C. Pharmacist in charge. D. DEA investigator. The correct answer is C. Pharmacist in charge. The pharmacist in charge, PIC, is legally accountable for controlled substance compliance, including inventory, security, and record keeping. Technicians assist with tasks, but do not hold legal responsibility. The exam consistently assigns compliance responsibility to the PIC. Question 85. During order entry, a technician accidentally selects the brand name instead of the generic equivalent specified on the prescription. What is the most appropriate action? A. Change it to generic without noting. B. Continue processing since they are equivalent. C. Correct the entry to match the prescription. D. Ask the patient which they want. The correct answer is C. Correct the entry to match the prescription. Prescriptions must be entered exactly as written. Even though brand and generic may be therapeutically equivalent, technicians cannot substitute during entry. Accuracy at this step ensures proper verification, billing, and dispensing. Question 86. Under federal law, how long does a pharmacy have to receive the follow-up written prescription after dispensing an emergency oral Schedule II medication? A. 24 hours. B. 72 hours. C. 7 days. D. 14 days. The correct answer is C. 7 days. When an emergency oral Schedule II prescription is dispensed, the prescriber must provide a written or electronic prescription within 7 days. Failure to receive it within this time frame makes the dispensing non-compliant with federal law. Question 87. A technician is entering a prescription and notices the prescriber wrote, "Take 2 tablets by mouth twice a day as needed." What is the primary issue with this SIG during order entry? A. PRN instructions must be avoided. B. The route of administration is missing. C. The frequency is unclear. D. The indication for PRN use is missing. The correct answer is D. The indication for PRN use is missing. PRN. Directions must include an indication, for example, pain, anxiety, so the patient knows when to take the medication. Without an indication, the SIG is incomplete and can lead to misuse. This is a common order entry clarification point on the PTCE. Question 88. While entering a prescription, a technician sees an active duplicate therapy in the patient profile. What is the technician's role at this point? A. Discontinue the old medication. B. Ignore it until verification. C. Adjust the dose to avoid overlap. D. Ensure the information is entered accurately for DUR. The correct answer is D. Ensure the information is entered accurately for DUR. Technicians do not make clinical decisions, but must enter information accurately so the DUR system and pharmacist can evaluate therapy duplication. Proper entry is essential for downstream safety checks to function correctly. Question 89. A prescription reads, "Take 1 tablet daily," but does not specify which strength of the medication. What should occur during order entry? A. Select the most common strength. B. Enter the medication without strength. C. Ask the patient what they usually take. D. Hold entry and refer the order for clarification. The correct answer is D. Hold entry and refer the order for clarification. Strength is a required prescription element for accurate processing. Technicians may not guess or omit required details. The order must be clarified by the pharmacist before entry proceeds to prevent dispensing errors. Question 90. During workflow, which task should be completed before a prescription is filled? A. Final pharmacist verification. B. Patient counseling. C. Will call bin placement. D. Data entry and label generation. The correct answer is D. Data entry and label generation. Data entry and label generation must occur before filling, so the correct drug, strength, directions, and patient information are available. Filling without a verified label increases the risk of dispensing errors.
Thank you for watching this video. We hope you enjoyed it. Check out these videos that can help you with your pharmacy exam. Don't forget to hit that like button and subscribe to our channel.